high blood pressure and 24-hour blood pressure monitoring. Stay tuned for this short and informative 9-minute video.
So this will be a short demonstration about the machine. So this will be the 24-hour blood pressure machine here. As you can see, it's very small and light like a cell phone. Okay, good afternoon. So my name is Dr. Rishi Ramtal. I'm a specialist in internal medicine, endocrinology and diabetes, and a hypertension specialist. So today we want to speak about the 24-hour blood pressure monitoring or ambulatory blood pressure monitoring. So first of all, for all the patients that do home blood pressure monitoring, I want to commend you all because that's the first step in making sure you get your blood pressure under control. But the 24-hour blood pressure monitoring is something that most people think is superior or better than the home blood pressure monitoring. So it's something that a lot of you may want to consider after seeing this video. So as the word suggests, it's 24-hour blood pressure monitoring. So when you take your blood pressure at home with a normal blood pressure machine, you might take it in the morning, in the evening, and you may sit down for 5 minutes and relax, which is good. So you get 2 readings for that 24 hours. Now, a lot of things can affect the blood pressure. If you angry with someone, if you exercise, if you run up a flight of stairs, if you're doing your normal daily activities, walking about and so on, your blood pressure can rise. So a lot of things could change your blood pressure. So what this test does, this 24-hour blood pressure test, is we get about 60 or 70 readings in 24 hours. So this is a sample report here, as you can see, and these are all the readings, about 60 or 70 readings in 24 hours. So as you could imagine, the more readings you have in 24 hours is a more accurate reflection of the blood pressure. So it'll give you a much better idea of what's going on with your blood pressure. So this would give you all these readings in 24 hours, and it would also give you the readings in the nighttime. The nighttime blood pressures are very important. Now, there's no way you can check your nighttime blood pressures other than doing this test. If you wake up in the night and check your blood pressure with the home blood pressure machine, it is still considered an awake blood pressure. Now, if you think about it, if you go to sleep, let's say 10 o'clock in the night and wake up 6 o'clock in the morning, then that's 8 hours. That's 1/3 of your day is when you are asleep. Now, we don't have any idea what's going on with our blood pressures when we are asleep. So a lot of diabetic patients, for instance, have what you call nocturnal or high blood pressure in the night, where the blood pressure is elevated. Now, the only way to get this information is to do the 24-hour blood test. Now, if you know what your blood pressures are in the day and you think your blood pressure is under control, there's still a chance that for 8 hours in the night while you are asleep, your blood pressure might be high and might still cause complications like heart attacks or strokes. So that's 1/3 of the days you are sleeping, and you really don't have any information on that with the normal home blood pressure monitoring. So it will give you an idea when you are awake, when you're asleep, and in the 24 hours. Now, the second thing is that a lot of patients think they can simulate the 24-hour blood pressure monitoring by doing the home blood pressures 30, 40, 50 times. Now, I've had patients who have tried that, but when patients check their blood pressure 10, 20, 30 times in one day, they tend to be preoccupied and only thinking about this high blood pressure, and that gives them anxiety, and that will give them falsely elevated readings. So, taking a home blood pressure reading 30, 40, 50 times a day is a very anxiety-causing issue, and it can make your blood pressures falsely elevated. So it may not be the best idea. Now, as the name suggests, again, it's something called ambulatory blood pressure monitoring. So this blood pressure monitoring is done outside of the office. So it's not done with the doctor. It's done at your own home or at your own work, doing your own normal daily activities. So we like to do it, let's say, in a typical day for you. So if a typical day is going to work, it will be automatically checking your blood pressure during different intervals, like every 20 minutes during the day, every 30 minutes in the night, automatically checking your blood pressure. So it's telling you what is going on with your blood pressure while you are doing your normal activities, which is very important. Now, when you check your blood pressure in the doctor's office or at home with a home blood pressure monitor, you're usually resting. But in daily life, you are not resting whole day. You are doing your daily activities. You're working, you're exercising, you're doing whatever you need to do. So the ambulatory blood pressure monitoring gives us critical information specific to you about what is going on while you are doing your daily activities. Another important thing is you can correlate your blood pressure readings with symptoms. So let's say you have dizziness, so we ask you to keep a journal to write down your symptoms when you go to bed, when you wake up, and so on. So let's say you had dizziness 10 o'clock in the morning. Then we could go back and we could look at the times here at 10 o'clock in the morning and see what happened to your blood pressure at that time. These readings also doesn't just give you blood pressure, but it gives you the heart rate. So we can also see what is going on with the heart rate. So for instance, if you are asleep, your heart rate should be lower than normal. If it's too high, that could tell us that something bad is happening. If your heart rate is high and you have high blood pressure, it may be related to exercise or pain. But if your blood pressure is high and your heart rate is normal, it may be something else. So it gives us information with that also, additional information. So one of the uses to do the 24-hour blood pressure monitoring is if you have a tricky patient that you're not too sure if they have high blood pressure, this will definitely be able to confirm their diagnosis. If you have difficult to treat high blood pressure, you're on 2, 3, 4 different medications and the doctor's still getting problems to control it, this can help. If you have fluctuations in the blood pressure, you're doing your blood pressure readings home, sometimes high, sometimes low, doing all kind of crazy stuff, this can help. Another issue it helps us is what they call white coat hypertension. That's when your blood pressure is only high at the doctor's office and it's normal at home. That's because of anxiety most of the time. So that can give you an accurate reflection of what is going on with your blood pressures at home. And if your blood pressures at home is always normal and only high in the doctor's office, then we wouldn't really treat it. If the opposite happens, where your blood pressure is only high at home but normal in the doctor's office, that's called masked hypertension. And that is also a dangerous condition that the 24-hour blood pressure monitoring can assist us with. And lastly, I would say it gives you an idea how your medication works. So if your blood pressure is good in the morning, then we know that your blood pressure was probably under control and the medication working for that period. But we don't know what is happening for the rest of the day or the night. So even if you check your blood pressure in the morning, lunchtime, evening, then we have a good idea that your antihypertensive or blood pressure medication is working during that time. But if we don't have an idea what is going on at night time and your blood pressure is very high in the night and we don't have that information, then you are still at high risk of heart attacks and strokes. So the other thing with the nighttime blood pressures is it's supposed to drop about 10 to 20% usually. Some patients' blood pressure drops too much, which is bad. Some people one does not drop, which is bad. And some people one actually rises, which is also bad. This shows the typical graph we would get. This is a graph showing the blood pressures over the full 24 hours. And the dark area is what goes on with the nighttime blood pressure. So you see the blood pressure would usually drop in the night. So we're looking to see if it drops too much, which is bad, if it rises, which is bad, or if it doesn't drop. And this is the importance, I think, of you all doing the 24-hour blood pressure monitoring. And we'll show you a sample video to see how it looks. So this will be a short demonstration about the machine. So this will be the 24-hour blood pressure machine here. As you can see, it's very small and light like a cell phone, right? And this will be for normal patients' blood pressure cuff. And if the patient has a big arm, we would use a bigger cuff. And then we would have things, so while you're walking around, we could have it strapped to you. So we would have it strapped to the patient here, so the patient could walk around freely and do his activities. And when he's asleep, he could actually take it off and he could put the machine under his pillow. Right? We'll just wrap it like a normal blood pressure machine. So we wrap it just like a normal blood pressure machine here, and the machine will automatically monitor the blood pressure every 20 minutes in the day and every 30 minutes at night. So the patient can walk around. When we attach it, we'll put it in this pouch. We'll attach it to the patient here. So the machine would be hooked up to the patient. We could put these cords inside the clothing if they're going to work and so on, whatever makes the patient most comfortable, and they could do their normal daily activities. And while they're doing, let's say they're working, as soon as the blood pressure machine's cuff starts to pump, the patient would just keep the arm still for about 30 seconds. Then when it finishes, they continue doing their daily activities. And this will happen in the night time also. Right now it's pumping, so the patient would stay still. And this would happen about 60 or 70 times in the 24 hours. While the patient is awake and while the patient is asleep, it will give us an accurate reflection of what's going on with the blood pressure. It's as simple as that. So you get all information, pulse, blood pressure, and we get that over 24 hours.
Call us today at 7475-297 or 308-3370 to book an appointment or visit us at number 4, Chincuna Gardens, Chin Chin Road, Cunupia. You can tap the description below for all of our contact information.